Today we want to see about scapula bone. This is left side scapula bone, which can be side determined by glenoid cavity. The glenoid cavity is always present in the lateral side of scapula, and here having the spinous process which directed upward to the lateral side of scapula bone. Next, we can see about borders. Scapula has three borders, which this is a medial border, this is lateral border, and this is superior border. There are three angles: superior angle and inferior angle, which is also known as tip of scapula, and glenoid angle, which is present in the glenoid cavity. And there are, next we can see about processes. There are three processor: coracoid processor, acromial processor, and posterior side we are having the spinous processor. In the spinous processor there are this line shaped structure, which is also known as chest of spinous or chest of spinous processor. Now we can see about surface of scapula. This is costal surface and this is dorsal surface of scapula. The dorsal surface, which can be divided into two parts, which is divided by spinous processor. The upper part of spinous processor is known as supraspinous process, and lower part is known as inferior spinous processor. Here we can see the small notch, which is called as supraspinatus notch, and in the glenoid cavity there are two cubicles, which in down is known as inferior glenoid cubicle, and superior is known as superior glenoid cubicle.
Okay.
That's all.
Okay. Can you see what is this? Can you see what is this hole?
Supraspinatus notch.
This hole.
Supraspinatus notch.
Supraspinatus notch. Okay. Can you tell me what is actually connecting these two?
Coracoacromial ligament.
So this one is
acromial.
this one?
Coracoid process.
Coracoid process. So connecting these two things?
Coracoacromial process. Ligament.
Ligament. Good. Right. Okay, ma'am. Sorry. Can you see we have a small hole here? Actually, we'll be having a notch, right? But we are having a hole. Can somebody say how it is formed? Really? Can somebody say? Actually, particularly I have asked him what is connecting these two things, right? See, this is one process and this is another process, and a ligament is connecting these two things. And what is the space which is produced in between these? What is that?
Spinous process.
Supraspinous space, right? Supraspinatus space. Okay, supraspinatus canal or supraspinatus space. Okay, the same way here also it is not yet actually connected. There will be a small notch, right? There will be a small notch only here, like this, right? But we'll be having a ligament which is connecting this area. Some soft tissues, fibrous tissues, which is connecting these areas. In due course, in due time, day by day, not in a single day, many years, many days, after many months or years, slowly this becomes ossified. This becomes ossified, right? Imagine there is pure bone here, right? Imagine there is a ligament, right? And that ligament is too hard. Slowly
The osteology process takes place. Slowly it becomes harder. After some years, it becomes a thick structure.
which after that which we are not able to separate the differentiate
The ligament as well as the bone. That will also look hard. That also becomes looking like bone. It is inseparable. So in due course, due to osteogenesis process, that also becomes like a bone. you will be having a connection here also. Generally, it is not happening because it is a big
structure. But this one is a small structure. There will be a small fibrous tissue, soft tissues will be there, and that is ossified easily. So you can see a notch here, and that notch, because of this ossification of the soft tissues which is covering the above notch, becomes ossified. In due days it becomes thickened structure and becomes bone like structure. Right now we can see a foramen here. Right, instead of that notch it becomes a foramen like structure. Right, got it? Can you see? Okay, good. Okay.